Hello everyone, welcome to Close-Up on America's Business, the program that takes you inside some of the most unique and successful companies in America. I'm Janice Marie. On each edition of our show, you have the opportunity to meet some of the most innovative business leaders in the country today. You'll find out what their products, services, technologies, and business models can do for you, and what they're doing to change our world and to change the way we do business.
It is no secret that obesity has become practically an epidemic here in this country. In fact, a national magazine recently ranked Dallas as one of the 10 fattest cities in all of America. You know, nothing makes a person feel worse about themselves than being excessively overweight. But now there is a relatively new tool available to help people take off those unwanted pounds. It is called the lap band procedure. It's been used in Europe and Australia since the mid-1990s, but was finally approved for use here in the U.S. by the FDA back in 2001. Since then, thousands of people have had this procedure performed. It offers safe, long-term weight loss without the complications of gastric bypass surgery. To learn more about it, we have come to consult with Dr. Lewis Fox. He is a board-certified general surgeon who is one of the most experienced doctors in all of Texas in performing this lap band procedure. Generally, it's done on an outpatient basis in a surgical suite just like this, located here at the Surgery Center of Richardson.
The lap band's been available in Europe since the mid-1980s and became popularized more during the 1990s and brought over to the United States and approved by the FDA in June of 2001. Since that time, it has grown exponentially in being placed into patients as an option versus gastric bypass surgery.
I've lost 114 pounds since I had the lap bands, over a period of 2 years now, since I came to Dr. Fox and did this. And I just feel so much better. Oh my God, I'm happier. I'm smiling all the time. I'm bouncing around. I'm being me like I felt on the inside. Before, I wanted to just bounce around and play around and laugh and talk. I was afraid people were going to look at me differently. Here's this big woman walking around, you know, and she's moving. If she falls, you know, nobody can pick her up, you know. So, you know, now I just love me on the outside as well. I keep these, and my gym has borrowed them. They keep them to show other people what can happen if they work hard at it. The lap band is a determination that you have to make in your mind. It's a mindset also, that in order to make yourself healthier, you got to do what's best for you.
Okay, Monique, how are you today?
Good, how are you?
I'm not too bad. Are you all excited about having the surgery?
A little excited, nervous too.
A little nervous. Everyone's nervous. But you're going to be very happy with having this band, and your weight loss is going to be extraordinary. You're going to be so happy that you've had this done, and you're going to be so happy that you're losing weight. The most important thing to remember is you have to drink lots of fluids post-operatively so you don't get dehydrated. And you have to do lots of walking. I want you to go home and walk, walk, walk. I want you to take your pain medicine so you're comfortable. And I want you to see me in the office in 2 weeks.
And what's the big difference between the lap band and the gastric bypass procedure?
Because you're bypassing the stomach and a portion of the intestines, the calories will not be absorbed, but also your vitamin B12, your B6, your iron, your calcium, and a lot of other nutrients aren't absorbed as well. And there's a good chance you may develop iron deficiency anemia, osteoporosis, vitamin B12 deficiency, etc. With the gastric band, all we're doing is placing the band on the top part of the stomach, creating a small pouch about the size of a golf ball. That's going to limit how much food you're going to be able to eat at one time. We're looking at 10 bites of food or less, and you will be full. And that's our goal. Fill up on less food.
So in effect, you're not really filling the stomach itself. It's not filled to capacity, is it?
We do not fill the entire stomach. All we want to do is trick the brain that, yes, we are filling the stomach by filling the top pouch. by creating a restriction with the band. We're going to narrow the band down so that the channel from top to bottom will be about pencil sized. So when you do eat and fill up your pouch, that food will empty through that pencil-sized opening to the lower part of the stomach very slowly. So you're going to stay full for a long period of time, 4, 5, 6 hours at least. And that's another goal we have with the band.
I like the lap band because it was reversible. It was something that I felt was a true fail-safe. I've had friends back home that had gastric bypass. You can gain the weight right back again. Your stomach, just stretches and stretches. And this was really something that I needed to know was going to be there long term. I'm very glad. I'm sorry I didn't do it sooner. Absolutely. 2 years later, after having the lap band, and we're sitting there like soup and a baked potato, and I just put some baked potato on the fork, and my daughter, "You are not going to put all of that in your mouth." I'm like, okay, I think I can handle it. So, you have to be ready for those kind of things. These are my fat pants. The biggest pants I ever wore in my whole life, size 22. And I wear a size 12 to a 14 right now.
Here's a prepared band that we're going to put around the stomach, and this will enter in like a belt in through one of the trocars, and we wrap it around the stomach to create that small pouch, and then we, just like buckling a belt, and we're going to lock this into place, and you'll see that it goes around the stomach to create that small pouch. And this end will be connected to an access port, which will be buried under the skin, that will be able to inject our saline. And we're watching everything on a video screen, and we can control what we're doing and place all our sutures, the band, and the access port. And this is very well tolerated. And what's nice about it, they go to recovery room for an hour, and then they go home within an hour after surgery.
Dr. Fox was actually recommended to me by my gynecologist when I went and did my research on it. I also researched doctors. He was one that had a very good record with people, seemed caring about his patients. I knew that aftercare was very important with the lap band, and I wanted someone that wasn't like a car salesman that once you buy the car, you're out on your own. I wanted somebody that would stay with me and work with me and care about my progress. It was very interesting going through the process. It really was interesting because it was a learning experience. You realize that you have a lot of things going on in your mind more that makes you put food in your mouth, and you really have to start dealing with some of those issues as well. You can eat around the band. I mean, it is a tool only. It's not the be-all end-all of losing weight. You have to work it the way it's supposed to. You have to work the program, you have to eat the right way, you have to exercise, you have to do the right things, and you have to get your mind right or it won't work.
And from your experiences, have there been any complications as a result of undergoing this?
This is a very, very low-risk operation. We have not seen any deaths in our practice. We have not seen infection or need of blood transfusions. We have not seen blood clots develop. Most patients are back to work in 3 to 5 days. Actually, they're driving a car in 2 or 3 days. So quick recovery, low complications.
Doctor, why is it important for patients who are going to have this procedure to see a nutritionist and a psychologist before they have it done?
The psychologist wants to make sure there's no underlying issues that will prevent the patient from succeeding, whether it be an eating disorder or a psychological problem. Most of the people say the only regrets they have about the surgery is they didn't do it years ago, because they're all so happy with it. Most of my patients are off their antidepressants, they feel good about themselves, and they now fit into society both socially and professionally.
And there you are, an inside look at the remarkable weight loss procedure known as the lap band, as performed by Dr. Lewis Fox. I'm Doug Llewellyn reporting from the Surgery Center of Richardson, located in Dallas.
Well, that does it for this edition of Close Up on America's Business. I'm Janice Marie. Thanks for joining us. We'll see you next time.